Hello. Why do ambulances drive so slow sometimes? Someone asked me. Why did they ask me? They asked me because I'm a flight nurse. Why does a flight nurse drive an ambulance? Well, because sometimes people get transported in the airplane instead of the helicopter, and we got to go pick them up at the hospital in an ambulance. So they're asking me why sometimes ambulances seem to be going slower than you would think an ambulance needs to go. An ambulance has the wee woo, and you put sick people in it, and you need to get to the hospital really fast. So why aren't you going fast all the time? And why sometimes they're going like really slow, like especially around turns and stuff. And I wasn't annoyed by this question because I understand it makes sense. But so I thought I'd make an effort at answering it. So there are two modes, generally speaking, that you travel in an ambulance. One is lights and sirens, and one is not lights and sirens. And there's rules about how you travel in each mode. Lights and sirens travel. You think about it on TVs and movies, and it's sort of this fast and furious style of driving, and everybody gets out of your way, and you get to the hospital in like 3 seconds, and it's great. In practice, it is very dangerous to drive lights and sirens. People sometimes get out of your way. Sometimes people get really confused, and I've gotten confused. You know, if I'm in the middle lane and someone's coming up behind me, it's challenging in an ambulance to convey what you're doing. It's not always super clear. And so going fast, doing something that confuses many people, and when fast is really maybe only 10 miles an hour over the speed limit, which lots of people are already doing, can create more chaos than it's worth. So the risk benefits most of the time are not worth it. There's a pretty short list of situations where we're going to transport somebody lights and sirens. And obviously in the ambulance, for flight nursing, very, very rarely, unless something has gone terribly south. So the other reason, so that's lights and sirens driving slower than you think they might. Um, when you get to intersections, you need to clear each intersection. You may have heard stories of ambulances getting into accidents, and that's terrible, of course, for many obvious reasons. The number one rule in EMS, and really should be in all of medicine, is to not create another patient. So that's why lights and sirens ambulances might go slower than you think they should. Thing number two is um, a little more nuanced. So if you're driving around and you see an ambulance that's going kind of slow by your assessment, it may be that we're doing an inter-facility transport, which is what we do with flight nursing. So if you see an ambulance that says critical care ground transport or something like that, it could be any ambulance, but particularly those ambulances, we're often transporting someone who is very sick and needs to go to a hospital that can provide specialized care for them, or just a higher level of care than what's available to them at maybe the wonderful hospital they came from, but they need some sort of specialized type of care that's not available there, like neurosurgery, for example, or they need to go to a more specialized trauma center, or they're a baby, or they are pregnant, or something like that. So those folks are often on a ventilator, so a machine that breathes for them. Maybe they're on a machine that helps their heart pump their blood around, or that is actually just literally pumping their blood around. Perhaps they're always going to be on a bunch of IV drips. So you have all of those machines in there, and even though they are secured, they're moving around. And then you have people in there who are maybe actively taking care of those patients. And then, especially if we're going to take the patient and put them in the airplane, there's the EMS gurney, and then there's a little thing called a clip deck, and then there's the sled, which is the 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 platform to which we secure the patient. So we've got all these layers of things that, no matter how secure they are, they're going to wiggle around a little bit. So, and that is amplified when you're in the back of an ambulance, and it's particularly amplified with things like braking, accelerating, and turning, which is basically driving most of the time, especially if you're doing anything other than being on the highway. So we have to slow down significantly on turns. We have to accelerate and decelerate slowly. We may have a patient's family member in the back, so even if people are restrained, it's still a pretty potentially chaotic environment, even if everyone's doing the best they can. So that's my little message. So if you see an ambulance and it's going slower than you think it ought to go, please trust that they may very well be taking care of a sick patient in there, and they've sort of done the math, and they know that getting to the hospital in 2 or 5 minutes longer than normal is much better than risking doing harm to the patient in transport, or even worse, getting into an accident. So that's my little spiel. I've just got off a 24-hour shift and making my bagel and was thinking about that question and sort of answering it in my head, and I decided I would answer it out loud into the internet voids. So that's all. Have fun. Be safe out there, folks. Love you. I mean, I don't know who you are, but I send that in your direction. I'm used to signing off "love you" in messages. So I don't want to dilute love, but I send loving like vibes, man. So there you go. I'm gonna eat my bagel and shut up.